So it's my delight really to introduce the panel, but I should actually say who I am first. I did mean to say that. So my name's Shilpa Jesudason. I'm a kidney specialist and academic across the road at the Royal Adelaide, and delighted to be part of this network. So if our panel members could please come up, and while you're coming up, I will introduce you. So we've got four people on our panel this evening. We'll be doing some directed questions, and then there'll be some time for the audience and people online to ask questions as well. So please start thinking about what you'd like to stimulate a discussion about. So we have Hutchesson MP. She's the member for Wait since March, and she has a diverse background which includes hospitality, the finance and banking sector, and she's most recently been the industrial advocate for the Finance Sector Union, and she's passionate about endometriosis and women's health and women's rights. So thank you, Catherine. We have Associate Professor Tamara Mackean, who is a Walyan woman and discipline lead for the Aboriginal and Torres Strait Islander Public Health in the College of Medicine and Public Health at Flinders Uni. She is also the co-lead of the Aboriginal and Torres Strait Islander Health Research Program at the George Institute, and has been a long-time advocate of building an Indigenous physician workforce, and is a life member of the Australian Indigenous Doctors Association. We have Professor Chien-Li Holmes-Liew, who is a lung transplant physician and Head of Thoracic Medicine Training and Education at the Royal Adelaide, and Professor of Medicine in the at Adelaide Uni, where she is Domain Lead for Clinical Practice and Medical Lead for the Respiratory and Sleep curriculum in the new BMD program there. And she established the lung transplant clinical research program at the Royal Adelaide, and has protected her patients from COVID over the course of the pandemic. And finally, Dr. Prabha Andraweera, who is a research fellow at the Robinson Research Institute and Adelaide Medical School, and in the University of Adelaide and at the Mackean, and her research program covers public health research, data linkage, clinical trials to maximise maternal pregnancy and postnatal health. So a really diverse panel with a range of experiences, and please do think about questions that you'd like to ask this group of fabulous women as we proceed. So I'd like to start with Tamara, and really interested in understanding your thoughts on what are the key priority gaps in women's health for Aboriginal and Torres Strait Islander women, and more importantly, what can we do about this?
Yeah, I'd like to add my acknowledgements to the Kaurna people for hosting our meeting. As Shilpa said, I'm a Walyan woman, which is in the northeast goldfields of WA, but I've been very fortunate enough to be living and working on Kaurna for the last 10 years. I also have a 16-year-old child who is driving and understand notions of lanes, perhaps literally as well as metaphorically. I could talk about a range of different health conditions. I could say that as Aboriginal and Torres Strait Islander women that we are overrepresented in homicides, that we are overrepresented in child protection services, that we have cancer that is detected later with worse outcomes. But that isn't the biggest gap from my perspective. I think the biggest gap that we need to struggle with in this country is actually a knowledge gap. And it's a knowledge gap that we deny every time we do not honour the sovereignty of the First Peoples of this country. And it's from that relationship that a great wealth of knowledge sits within our grasp. And I actually think we need to be aware of what that is so we can connect with it and engage with it in a very purposeful way. We've come from a very long-standing tradition of a colonising genocidal intent that makes people feel uncomfortable, but that is also one of those uncomfortable truths that we need to reconcile both within ourselves as individuals, within our professions as well as within our society. If we are unable to acknowledge the First Peoples of this country, we are losing millennia of knowledge on health and healing. And we can't afford that as a society. And so when you ask me about gaps, I actually think we have different models of health and healing, and that's what they are, different. They are not inferior, they are not less worthy, they are not illegitimate, they are not mythical fantasy. They are valid knowledge systems, but they are constructed very differently. And our issue is the education, both of our health researchers and health professionals, that continues a representation of Aboriginal people, but particularly Aboriginal women, in a very negative-based deficit way, as sex slave, as domestic slave. Those things are huge gaps for us in our society, and we need to be able to understand and introduce a very different narrative that is about the empowerment of First Nations women, that is about the inclusion of our knowledge systems, and is about tackling the issues as we see fit. We are not without agency. We have been painted and portrayed as people without agency, and that is not the case. Racism is killing us. I think you would have seen more recent coronial reports, two quite confronting ones for women. Some of you would have seen some footage with regard to how Miss Dew and the Kimberley passed away. Some of you would recall that she was dragged across the floor by her arm as she was clearly dying of sepsis. You wouldn't treat a dog like that. And that is in the last 5 years. Ms Williams at the Tumut Emergency Department, 6 months pregnant, was presented 26 times to that emergency department, and then her and her unborn child died of sepsis after she was sent home with 2 Panadol. Uncomfortable, difficult, but absolutely changeable. Absolutely changeable. So part of that change is about making and holding space for us. I really enjoyed all the presentations this evening, but I didn't see myself in many of it. I don't think that's something that is intentional by any means, but those are the kind of biases that we need to check amongst ourselves and be prepared to support each other to change it. Holding space isn't just about having someone like me sit in a chair like this in a panel in this forum. It's actually about when we're not here, when we're not in the room, what you say for First Nations women when they can't be there. And that's a really, really critical thing, because it's easy to be forgotten. And I think women here would understand what that is like. And so in that shared space, that shared experience is where we can come together and really support each other and speak for each other when we need to, but not speak over one another. Fundamentally, we have to always connect back to community. It is about our patients or end users of research, but more than that, it has to be back to elders and back to community and back to our children. Our children are gifts. They are the core of human sustainability, and they need to be treated with respect. And as Aboriginal women, we have so much to offer in that space. We have to be able to have those community connections that are genuine and meaningful, and move away definitely from a ticker box exercise. Thank you.
I think that's very powerful. I think it speaks to all of us. I will follow up with another question. When you're talking about creating those shared spaces where we can all come together and work together, what can we as researchers do that's really concrete and tangible that we can, what do you think we all should do, everyone in this room, everyone who's listening tonight, tell us what we can do that can take that next step from the minute we walk out of this door.
Yeah, thank you. I'm going to steal someone else's line, but I like that concept of mobility, but I would challenge you to be methodologically mobile. Different methods, not just quant, not just qual. Think about Indigenous research methodology and Indigenous research methods. Yarning, deep listening, holding space, collective approaches to analysis, collaborative working from the get-go. We have really good courses in Flinders for this work, led by Simone Ter. This type of research isn't a subset of existing Western-based research. Our knowledge systems mean we have our own ways of asking and answering questions, and we can talk about those ways and share those ways and build that into our ways of understanding some of the most complex problems in our society.
Thank you. So my next question is to Chien-Li. As a clinician researcher, I'd like you to explain to us some of the challenges you think that we're facing. Are we a dying breed? How can we keep that sustained, and how can the system better support women who are in the early and middle stages of their career to continue to integrate those two roles?
Thanks, Shilpa, and thanks for inviting me to be on the panel. I just feel very privileged to be amongst this incredible group of people, so thank you very much. And I will say I have a 7-year-old daughter who's not driving, but who did write me a letter a few days ago complaining about how, of the 3 of us in our family, she's the only person that hasn't got to have a turn at driving, and she'd like that to change soon. So I think I might be hopefully raising a strong, independent woman with goals and ability to communicate semi-logically. But back to the topic at hand, I think there are quite a few challenges faced by clinicians undertaking research at the moment, and one of those is that undergraduate medicine is all about the clinical side of things, but then career advancement for a clinician academic is about research. And as some of the other speakers have put much more eloquently than I will, there's no defined path for a clinician researcher. And so in the junior medical training years, it's all about rushing around, getting hands-on experience with patients. And for us, patients always come first. And so at the end of a really busy day, as a junior medical officer, whatever passion or bright ideas that one might have about a research project, there's just no space in a lot of the day from a time or just a brain space point of view to pursue these research interests. There have been attempts to sort of build this into to the day-to-day life, I guess, with the college. Most colleges obviously require research to be done, but a lot of the time, because clinicians are heading towards a clinical goal, these become more hurdles, and they'll tack onto a project that someone already has ready so that they can be guaranteed that this will be achieved as yet another hurdle to the place that we're going. Whereas I think that what we really, in an ideal world, would do would be to support people who have an idea and to help them to build that idea into a project that comes to fruition, that can carry along other people that might be able to contribute to those ideas. And I think that that's how visions for research and how greatness in an institution from a research point of view comes about. I think for women there are also some very key differences, and as research is often seen as a luxury, a lot of the time our spare non-clinical time is spent, as I think Jodie pointed out, or it might have been Claudine, doing the service roles in the department. So the females will come up with the system for triaging, or the females will arrange the meetings in the department. And again, there's only so much time in the day, and so then when you step back and think that that time was spent doing things for the good of the department and not for building a research profile, then that also becomes a barrier. And in terms of starting families and working part-time, we still have a long way to go in terms of support for women who would like to do this. And so there's often a scramble to prove our worth if we're working part-time, to show that we're still seeing the same amount of patients, that we're still doing all those service roles. And again, because research for a clinician is often seen as a luxury, that falls to the wayside. I think also an unfortunate challenge is now, and probably the elephant in the room, is still the degree of sexism and racial stereotyping that does go on in many institutions. And unfortunately, I was talking to one of my colleagues today, and I said that sometimes it feels like we're all running a 100-metre race, but if I have to run a 100-metre race and there are a bunch of white males in the race, that I have to run a marathon before I can get to the start of the 100-metre race and actually run it, and then I have to be faster than them at running that 100 metres. And we see that a lot it takes energy to maintain our seat at the table. It takes energy every time that you have to reassure someone that you're not the lady that brings the flowers, but you're actually the respiratory physician in the room. It takes energy every time your male colleagues are called by their titles and you're called by your first name, and you have to think about whether to fight this particular battle. That all takes energy, and that energy could be used to do research, to be inspired, to put into creative activities. And so I think the system has to change, but I think that it is changeable, and it does, as many people have pointed out, start with each of us in the room, and there's a lot that can be done.
Thank you. I see everyone nodding, and I'm sure people are nodding online. That speaks to lots of people. I think one of our take-home messages from tonight is going to be: think twice the next time you're asked to do a service job, and actually think, well, you know, why am I being asked to do this, and then run like a marathon away from that that role, perhaps. So, Prabha, you're a hot and emerging research leader, and you're involved in so many things. Some of them with me. I'd be interested to hear what are the key things that have helped you in developing your research career, getting you to this point, and what do you think you're going to need to get to the next point, and what do you think we need across women's research to support people getting to your stage?
Thanks, Shilpa, and thanks for inviting me to be on this panel today. So thinking of, we've discussed, I think, quite a lot about the barriers women face and things that need to be changed. So for me, things that I have found, one of the things that I have found most important as a early mid-career researcher is the collaborations that I was able to build after finishing my PhD up until now. So I felt that although people tend to talk a lot about collaborations and tell the importance, I've always felt that the important thing is to identify people with whom you can build effective and mutually beneficial collaborations. So sometimes it might not be that you need to find a very senior, successful researcher, but it could be some other EMCRs who might be able to help you in your own projects, help you build up your track record in publications. So that's one thing. And another important thing I found is finding a good mentor, or I would say someone who's basically a role model. Because again, it's easy to tell people, get papers written up, apply for grants, but sometimes you need to see how it's being done. So I've always felt that if I observed a senior female researcher who juggles all these grants, publications, managing a team, as well as managing a family, I've learned a lot from those people and thought if I could be like them, I could be more efficient and more effective. And the third thing I would say is your research team, because you spend a lot of time with your research group, and how supportive your team is means a lot when you're a junior researcher, and how the others involve you in their research is also important. So as a junior person, what I found is, so if as a junior postdoc, say you lead one project, and there could be other 2 postdocs in your group who have 2 other projects. But if you collaborate effectively, and you end up writing, say, 2 papers per year as a first author, and the other 2 again write 2 papers each, and you help each other in your project so that you're all co-authors. You end up getting 6 papers. And that's quite a bit as a junior person. So I feel the team means a lot. And then from the team, of course, your team leader or your research leader has a big role, because it's the team leader who delegates tasks and who sees how the group works effectively. So that's a really important thing. Especially, we all know that there are years when all your papers get accepted. There are times when all the little grants and big grants are successful, but there are more often times as a junior researcher that it's hard to get some publications, and it's hard even to get the smallest grant is sometimes not successful. So at those points, I feel that your research leader has a big role to play in helping you as well as supporting you. In addition to those major things, I found a few other little things like attending conferences and listening to other people, networking. You always learn from those. And lastly, I think the last thing would be to be persistent and be resilient, because as I said, every time a grant fails, you can't really feel demotivated. You have to be able to hold yourself up and be able to apply the next year. And the second time you apply, most often it's a more polished grant. So to be resilient is, I think, one of the key things I found.
Yeah, definitely. I think we're all finding depths of resilience amongst ourselves when it comes to grant writing. But I think, I mean, you've mentioned, you know, the collaboration and that teamwork and actually taking everyone along with you as you're progressing. And I think that's very much a cultural change in academia that we all need to be promoting. And, you know, it's something that each of us can do in our day-to-day work to help other women along. So, no, thank you for that. My final question goes to you, Catherine. Thank you very much for coming along. You know, I think it's wonderful to have your voice and to have your capability listening and also taking the messages from here back. So my question to you is around how governments and policy support around women's health can help us translate some of our work into practice, because I often think that that's where the barrier is. Some fantastic research gets done, but to try and get it out there really requires the next level, often government engagement. So I'm interested in your thoughts on how we can develop those initiatives.
Yeah, thank you, Shilpa. So first of all, I'll just let you know my phone went off before because that was my 18-year-old telling me he'd found a car he needed to buy. So it continues on when they get older, so I'll be having a conversation with him when I get home. It's interesting, I accepted an invitation to the ASMR Medical Research Dinner a few months back, and I sat down next to Dr. Wendy Ingram, who's sitting over there now. And who would have thought a conversation with her would end up with me sitting here? But I thank you, because it really started my journey of working with researchers and learning more about what you all do every day and how I can help. So from Wendy, I moved to the Robinson Institute. I've got Beck and Jodie over here, who I sat and I listened to their plan and their program, Endozone, which was especially critical to me because I suffer from endometriosis and have done for 18 years since that new car owner was born. And so to me, I've always tried to learn a lot myself about my disease. And when I talk to other women, I do what I can to sort of push them in the right direction to find their answers. But in terms of government, I was elected 6 months ago, so it's all new to me. But what was exciting when I was elected was that a whole lot of other women were elected. For our side of the chamber, 7 women came in one day. It took 90 years to get 7 women elected before that. And I think when it comes to medical research of women's issues, I know we don't like that, but having women in Parliament who are there to advocate on behalf of our problems and the things that we have to deal with every day and how we get to the solutions is a really good place to start to help in this translation piece. I know I've already spoken in Parliament about endometriosis, about the Robinson Research Institute, and that will be ongoing for me. I've also met recently with Pelvic Pain Australia, and I've written a letter to the Minister about what they're doing, and they're educating young people about their bodies and what's normal and what's not normal, and what to take to your doctor when you experience those things. And what's been interesting about listening to the panel, and by the way, I think if we could harness the brain power in this room, we could solve climate change with the energy. But my role before becoming a politician was an industrial advocate, and women would ring me all the time and let me know that things weren't happening for them in the workplace simply because they were women, quite often because they were middle-aged and because they were seen to probably want to go off and have a baby, so why would we promote you? And I think what we need to do as women is really back each other in. We need to get stronger at asking for things and stronger at promoting things. And in terms of medical research and that translation piece and getting your research to market, to clinicians, and then to the education piece to the consumer or the patient, it's about supporting each other. And I think the more we can do that, the more we can push each other to do well. And what I liked about the Robinson research was there were a lot of women there that were talking to me, and I think that's wonderful. And you are all here today and online. We need to take that next step and go and see your local MP. I've had people come and see me about all sorts of things, including lymphedema. We spoke with Monique from the Lymphedema Association and how much work she does. She doesn't stop. So the more you don't stop, the more that you do get. So in terms of policy, we will make our policy by what we're told. I'm not a scientist. I tried, but it didn't work for me. But learning, meeting people is how I will take those things to Parliament. So advocacy in that space is really important.
So I'm hoping that you're not going to get swamped at the networking event because we've got sort of one person here. But what is a tip that you could give us if we're trying to get our voice heard and get the ear of somebody in government?
Yeah. So, I mean, for me as an advocate before and an organiser before at a union, the more you do it together, the more you get. So take your whole group, book a time to see your local MP as a starting point. It's hard to see the ministers, so you're better to start with the MPs, and federally Louise is here as well. And obviously there's a big national platform for endometriosis, which I think is wonderful, and I'd love to bring it into state as well and push Louise to look after us over in the federal space. But make that time. I know you're incredibly busy, but if you need that support and you want to get your research across the line, you need to tell us what it is. We probably don't have the time to read all the information that comes, or whether it's, what you see on the TV or what you hear about. You're all studying incredible things, and I think when I was at the medical research dinner on my table, there was some incredible research going on. No one was studying endometriosis, so I had to bring it up anyway, and I'll bring it up no matter where I am. But come and see us, come and talk to us, make a time, and let us know what you're doing, because that's how we will then be able to advocate back to the minister, whether it's state or federal, and see what we can do. We can't solve every battle every day, but we definitely want to support women doing the best that they can. And yeah, it's a passion of mine. So if you live in Waite, feel free, come and see me. But if you do need help finding out who your local member is or how you go about that, I'm happy to have that conversation as well.
Thank you. I mean, that's great advice, and I think bringing the patient voice along with you as well is really powerful and a good strategy. So thank you. We've got a couple of questions for the panel.
So the first one is for Chien-Li. How do we change the institution's view on valuing research as part of our clinical role, especially for disciplines like nursing?
Thanks, that's a great question. I think that healthy leadership is probably one of the first steps towards that, and as many of the other speakers have said, and it resonated with us, it's building research into the day-to-day life of all clinicians, and understanding that that's a component of what we do and how we contribute in our field. And I think that it's also really important to know that research can be supported in many different ways. So a leader might not be the world's best researcher or might not have a passion for their research personally, but it's about supporting the people around who are talented in that area and giving them protected time to do that and to thrive in that environment. So I think a leadership that recognises, I guess, and this goes for a lot of things, not just research, I think, but a good leader would support the people around to recognise their strengths, and then by that would be able to draw out the research talent that is within an institution. I think that in itself is probably not enough, though, because we need to have structure and we need to have a clear pathway and time built in, protected time and an expectation, because we're all very driven, and so it's expected that we do our clinic. It's expected that clinicians see the patients and write protocols and so on, but it's not expected that people contribute to research. And so if that was more built into what the expectations of a role are, which is not a difficult change, I think it's just a bit of a frame shift in mindset and about an institution adopting a way forward that research and academia is part of a healthcare institution.
And I think it speaks to having time in your paid time, and that research is not something that you do after hours in your own time as if it's a hobby like knitting or gardening, but it's actually valued and embedded. So thank you. Are there any questions from the floor? We have roving microphones and we've got time for one or two questions. And in the meantime, while you're thinking about your thoughts, because I can't see any hands up, we've got, Tamara, one more online question.
Yep. I'm not quite sure who this one's for, so I'm going to look at all of you. What about professionals other than clinicians, such as public health graduates or masters? Is there anything for supporting women from public health backgrounds?
Thanks, Tamara.
Thanks, Tamara.
There are different pathways, I think, and it's not always clear which pathway suits which people. So my role in public health has been as a medical practitioner, and so that wasn't where I thought I would end up, but that's where I've ended up, and that's how I've gone into research that way. But if there was ever a time when public health was going to get as much promotion as it has, it's been the last couple of years during a worldwide pandemic. So I think now is a good opportunity for there to be more structured thinking and more structured career pathways. And so working from a Bachelor's of Public Health, going to a Master's of Public Health, and getting those industry relationships in the public health space, both with government in more traditional public health, but also in the corporate world, where we now know the links between how organisations work, how corporates do their business, both in terms of keeping their staff and their customers safe, their own environmental footprint, what that means from an energy perspective. These are all public health issues. And I think that we can make a greater connect with industry for fostering public health research pathways, but we do probably need to think a little broadly and a little more creatively. A little more ecologically, perhaps, is something that I think has definite traction.
Thank you for that answer.